Well, news coming in from Jammu now. Pregnant women in Kishtwar area of Jammu has alleged that they were being administered with drugs and medicines which have way expired their date of manufacture and, of course, date of usage. So an inquiry is now being ordered after families of pregnant women in Kshtwar alleged that patients were being administered expired medicines. Expired glucose bottles were noticed by the relatives, following which they raised an alarm. According to the family members, hospital authorities tried to hide their failure and even destroy those bottles before they could be reported. However, the district commissioner said that expired bottles found haven't been administered to any patient. Let's listen in to the D.C of Kishtwar.
देखिए, मेरे नोटिस में ये आया है, वहाँ देखी गई एक्सपायर्ड डेट वाली, हालांकि उनको वो दिया नहीं गया था अभी, लेकिन स्टिल मैंने प्रिलिमिनरी इंक्वायरी कर ली है। उसमें मुझे कुछ फैक्ट सामने आए हैं, तो मैंने एक फॉर्मल इंक्वायरी एस्टैब्लिश की है। चीफ मेडिकल ऑफिसर को कहा है जल्दी से इंक्वायरी करके मुझे 2 दिन में रिपोर्ट देगा। जहाँ कहीं भी खामी होगी, जो भी कसूरवार पाया गया, ज़ाब्ता एक्शन लिया जाएगा।
Well, this is a serious matter that has come to fore from a district hospital in Kishtwar of Jammu, where relatives of pregnant women have alleged that they were being administered, the patients were being administered expired drugs. This is a major case of medical negligence. The hospital authorities at the district hospital of Kishtwar provided expired medicine to majority of the pregnant women who had undergone an operation or had delivered a baby. The expired medicine includes glucose fluids which had expired in the month of October 2019. Nearly 10 months exceeded from the date of expiry, and the concerned officials, including the store in charge, failed to destroy these expired doses of medicines or failed to separate them from the other medicines which had not expired. Well, after the patient's attendants noticed this goof up, they raised an alarm. The hospital management, of course, swung into action for damage control. Let me go across to Pradeep Datta, who joins us live for more. So, Pradeep, we here on Mirana continuously look at such issues of medical negligence because, after all, the lives of people are at stake. This is inexcusable for a district hospital to be lax to this extent, not to discard expired medicine bottles.
Yes, you are absolutely right. In fact, it's a case of criminal negligence. And this happened inside the maternity ward of the Kshtwar hospital, where they are supposed to provide the better medicine, better care to the women who are pregnant. Either they have delivered a baby or they are about to deliver a baby. But in this particular case, it was seen that all those glucose bottles, those are to be intravenous provided to all these patients. They were having expiry date. And these bottles, in fact, had expired in the month of October last year. And
yes,
means after 10 months, they are going to use the same bottles for the patients here. And it was only when one of the attendants was able to notice this thing, he brought it to the notice of the authorities there. Instead of immediately acting against the storekeeper, what they did, they tried to, in fact, destroy those bottles because they wanted to destroy the evidence. They did not want the people to come to know about all these things. But now the deputy commissioner, what we came to know, has come to know about all this, and he has ordered an inquiry. Preliminary inquiry reveals that yes, these expiry bottles were there in the hospital, and he has asked the authorities to submit the report within 2 days. Because as you rightly said, that here on Mirror now we had been bringing these stories which in fact concern the people and how the life of the people had been affected, because you can't just risk the life of the people because you want to provide them the expiry medicine. When people are coming to hospital, they're always expecting a better kind of a treatment. If at some point of time we have seen that if the ambulance is available, the stretcher is not there, the stretcher is available, the medicine is not there, and if the medicine is available and that is of the expiry date, so what can be more dangerous than this thing? So I think this is the time for many heads to roll, and let's see what will be the outcome of the inquiry and what kind of action will be initiated. So far as when we spoke to the Deputy Commissioner Rajinder Singh Tara, he's ensured that action will be initiated, all those people whosoever will be responsible for that.
Absolutely. The first step then is to at least accept that there's been a mistake and correct it rather than try to hide the failures. Thanks for joining us, Pradeep, with your inputs on the story.